Here are top 10 urgent diabetes warning signs you need to know. Today, we're diving into a crucial topic that could save your life or the life of someone you love. Make sure you stick around until the end, because the last sign is one that often gets overlooked but can be incredibly dangerous. Even so, it is important to watch the entire video so that you are aware of the signs. Number 10. Confusion or difficulty concentrating. This can be one of the more subtle but serious signs of a diabetes emergency. When your blood sugar levels are too high or too low, it can directly impact your brain function. High blood sugar, known as hyperglycemia, can lead to symptoms like confusion, dizziness, and an inability to focus. On the other hand, low blood sugar, or hypoglycemia, can cause similar cognitive issues, making it hard to concentrate or think clearly. These cognitive symptoms happen because your brain depends on a steady supply of glucose to function properly. Too much or too little glucose disrupts this balance, leading to mental fog and confusion. Number 9. Tingling or numbness in your extremities. This is a common sign of nerve damage caused by high blood sugar levels, a condition known as diabetic neuropathy. Diabetic neuropathy occurs when prolonged high blood sugar damages the nerves, especially those in your hands and feet. This nerve damage can cause a range of sensations, from mild tingling to severe numbness and even pain. These symptoms are not just uncomfortable, they can also lead to serious complications. For instance, numbness in your feet can make it difficult to feel injuries or infections, which can worsen without proper care and potentially lead to severe infections or even amputations. Number 8. Slow healing wounds. If you notice that cuts, sores, or bruises are taking much longer to heal than usual, this could be a warning sign of diabetes. High blood sugar levels can impair your body's natural healing processes in several ways. Firstly, elevated glucose levels can damage your blood vessels, reducing blood flow and slowing the delivery of essential nutrients and oxygen to the affected area. Secondly, diabetes can weaken your immune system, making it harder for your body to fight off infections. This means even small wounds can become serious if not properly cared for. Number 7. Fruity breath odor. If you notice a sweet, fruity smell on your breath, it's important to seek medical attention right away, as this could be a sign of diabetic ketoacidosis, or DKA. Diabetic ketoacidosis is a serious complication of diabetes that occurs when your body starts breaking down fats for energy instead of glucose, due to a lack of insulin. This process produces acids called ketones, which can build up to dangerous levels in your blood. One of the key signs of DKA is a fruity smell on the breath, which is caused by the presence of acetone, a type of ketone. This odor is often described as similar to nail polish remover. Number 6. Nausea and vomiting. These symptoms can be more than just a sign of a stomach bug. They can indicate a serious diabetes-related condition called diabetic ketoacidosis, or DKA. Diabetic ketoacidosis occurs when your body starts breaking down fat for energy instead of glucose because there's not enough insulin available. This process produces ketones, which are acids that can build up in your blood and make you very sick. Nausea and vomiting happen because your body is trying to get rid of these excess ketones. These symptoms can be accompanied by other signs of DKA, such as abdominal pain, shortness of breath, and fruity-smelling breath. Number 5. Persistent fatigue. If you find yourself feeling unusually tired all the time, it might be more than just lack of sleep. It could be a sign of diabetes. Persistent fatigue can occur when your body isn't able to use glucose properly for energy due to insufficient insulin or insulin resistance. This means that despite having enough food, your cells are essentially starving for energy. High blood sugar levels can also cause dehydration, which contributes to feelings of tiredness. When your kidneys work overtime to eliminate excess glucose through urine, you lose more fluids and essential nutrients, leading to dehydration and fatigue. Number 4. Unexplained weight loss. If you're losing weight rapidly without changing your diet or exercise habits, it could be a warning sign of diabetes. Unexplained weight loss happens when your body can't get enough energy from the food you eat. Without sufficient insulin to help glucose enter your cells, your body starts breaking down fat and muscle for energy. This can lead to significant weight loss, even if you are eating normally or more than usual. It's your body's way of trying to compensate for the lack of energy it's receiving from glucose. Number 3. Blurred vision. If you suddenly start having trouble seeing clearly, it could be more than just needing new glasses. it might be a sign of diabetes. Blurred vision occurs when high blood sugar levels cause the lens of your eye to swell, which affects your ability to see properly. This change in shape and flexibility of the lens can make your vision appear blurry. When your blood sugar levels are too high for an extended period, it can also damage the blood vessels in your retina, leading to more serious eye conditions like diabetic retinopathy. This can further impair your vision and, if left untreated, may lead to blindness. I'm even going to leave a video on the cards explaining everything about diabetic retinopathy. It's super important for you to understand better. Number 2. Shortness of breath. If you're experiencing difficulty breathing, it could be a serious indication of a diabetes-related emergency. Shortness of breath can be a symptom of diabetic ketoacidosis, a life-threatening complication that occurs when your body doesn't have enough insulin to process glucose for energy. When your body can't use glucose for energy, it starts breaking down fat for fuel instead. This process produces acidic ketones as a byproduct, which can accumulate in your blood and lead to a condition known as acidosis. Acidosis can cause your breathing to become rapid and shallow, leading to feelings of shortness of breath or even labored breathing. This is a sign that your body is in distress and needs immediate medical attention. Number 1. Extreme thirst and frequent urination. If you find yourself constantly thirsty and running to the bathroom more often than usual, it could be a sign of diabetes. When your blood sugar levels are too high, your kidneys work overtime to filter and absorb the excess glucose. However, when they can't keep up, the excess glucose is excreted into your urine, drawing fluids from your tissues along with it. This leads to more frequent urination. As a result, you become dehydrated, which in turn makes you feel extremely thirsty. Drinking more water might help temporarily, but as long as your blood sugar remains high, the cycle of thirst and urination continues. If you like this content, give it a like and subscribe to the channel. It doesn't hurt to do anything. I'll be grateful. Bye.